Today we are discussing Unit 2 of the 12 units that are in this course. My name is Kombe Kelvin. I'm a registered nurse as well as a transformational leader. So in Unit 2, you find management functions, which we summarize by the letters P, O, D, C, C, S. These letters will help you to memorize the management functions easily. P is planning, O organizing, D directing, C controlling, the second C is coordinating, then the last S is for staffing. These are management functions. Soon you are going to be a manager. A nurse is a manager, and you shall be required to perform these managerial functions. In this video, I will be explaining to you in simpler terms by giving you examples so that you can understand and remember the information. A question might come: you are working as an in-charge at Tembekwayo Clinic in George Compound. Explain how you are going to carry out your management functions. So these are the management functions. The first one is planning. What is planning? Planning is the process of setting goals, developing strategies, and outlining tasks and schedules to accomplish the goal. Ladies and gentlemen, you come up with goals. You develop strategies on how to execute those goals. You outline the tasks and schedules to accomplish the goal. Here is my favorite and simple definition of planning. It is deciding what is to be done, how it is to be done, when it is to be done, and by whom it is to be done. When you are planning, you are deciding, trying to see what do you want to do, how is it going to be done, when is it going to be done, and who is going to do it. If you are at a clinic, you are an in-charge, and your clinic doesn't have a counseling department, you plan of wanting to have a counseling department. You start by knowing what is required for you to have a counseling department. You need a counselor. Are you going to have someone who has a certificate in counseling, someone with a diploma in counseling or a degree? You are planning. What do you need in that department for the department to learn effectively? Do you have space at a clinic where that department will be placed in? By doing that, you are deciding, you are planning. Now, what is the importance of planning? Planning reduces overlapping and wasteful activities. When you plan, you know what is to be done, when it is to be done, who should do that, and that will prevent overlapping and wasteful activities because you know what must be done. The second point is planning facilitates decision making. When you know what must be done, you'll be able to know that you'll be able to make decisions precisely. Let's say you are driving a car moving from point A to point B and you face a corner. When you face that corner, you look on your plan or on your map and it shows you have to turn to your right. That's a decision. You are going to make a decision of turning to your right. Why? Because you have seen that on the map it is telling you to turn to your what? To your right. That is the planning facilitating decision making. Planning establishes standards for controlling. We will understand soon what controlling is, but for now we can know that planning establishes standards for controlling. It helps you to come up with standards which will help you to control what you are doing. Number 4, it enables us to determine resources that we need. When you come up with a plan, for example, I talked about the counseling department. As an in-charge, it is going to help you to determine resources that you need. I need registers. I need a table. I want this department to be to give some privacy to clients who be seeking for counseling services. Okay, so it will be at the corner of the clinic so that people cannot be seen. You are trying to see the resources that you need. That is planning. That is the importance of planning. It enables us to assess progress towards achieving the set objectives. When you know your plan, you've set goals, you've stated strategies to achieve those goals. So it will help you to know how forward are you moving to achieving those goals or set objectives. Planning prevents possibility of crisis management. Planning reduces the chances of you having a crisis. For example, you know that the rainy season is coming and people might start suffering from cholera. What you have to do at your facility is you plan in advance. Okay, we will need PPEs, protective personal equipment. We need more antibiotics. We need chlorine, so that when cholera comes, that crisis won't be impactful or it won't affect you to that extent. Planning provides directions. Remember the example of a map I gave? You are just following the map. You move to your left, you move to your right, just like that. That is planning. Now, this planning has got types. Let us discuss these types of planning. The first one is the strategic planning. It is conducted by top management and is a process of determining overall objectives of an organization. It is a long-range type of planning, e.g. for 3 years. We would say these are some of the plans that occur at the Ministry of Health in our profession as nurses. Then we have intermediate planning. This type of planning covers a lifetime of 6 months to 1 year and is contemplated by mid-level managers. These also have task of polishing up on top management plans. So if the intermediate planners, these ones that are on the mid-level management, when they receive plans from the strategic planners, the ones that are on top, they polish them to make sure that they are okay. So intermediate planning, this is where we can put the principal nursing officers, the chief nursing officers. Yes, they are the middle-level managers. Then operational planning, this is the planning done by lower managers. These are short-range plans covering a lifespan of 1 week to 1 year. These plans are more specific and determine how the specific job should be done in the best possible way. These are the in charges in the wards. They make plans like making the schedule of how nurses should work, night shift, day shift, afternoon, morning shift. These are the in charges that are on operational level. Now let us move to the next part, which is organizing. So what is organizing? By definition, it is the process of identifying and grouping of the works to be performed, defining and delegating responsibility and authority, and establishing relationships for the purpose of enabling people to work most efficiently. Just like in your room, if you look, there is a place where you put books, a place where you put plates, a place where you put your shoes, a place where you put your clothes. That is organization. You have grouped those things. This is what we are discussing even here. We are saying organizing is just the process of identifying and grouping of works to be performed. When you group those things, you define what are they. Okay, these are shoes, these are plates, and you even delegate responsibility and authority. That is just organizing, ladies and gentlemen. I'm an event organizer. They are just putting things together so that things can happen. That's what organizing means. Now, organizing also has some importance, and here are they. Number 1, organizing helps to reap the benefit of specialization. As I said, your shoes are here, your clothes are here, your plates are here, and you have got soap which you should use to wash these things. You'll be able to know which things need a lot of soap. Yes, so in a ward as an in charge, you have got an RN, you have a theater nurse, you have a midwife, you also have a radiographer. You'll be able to send these people in different places. An RN where there are medical conditions, a theater nurse to the theater room, That way, you are reaping from the benefits of specialization, because we said organizing is grouping things into their categories and also allocating responsibility and authority to them. So when you give an RN medical and surgical conditions, they will be able to deal with them in a good way, because that's their specialty. A midwife in a labor ward, she will be able to handle the mothers there because that's her specialty. Hence, from that organization, you are reaping the benefits of specialization. Number 2, organization provides for optimum utilization of resources. When you have put things in 2 groups, bay 1, bay 2, bay 3, you will know which place, which bay needs more syringes, which bay needs more cannulas, because you have organized things in a ward. So you will even benefit, or there will be an optimum utilization of those resources because you have placed the things in groups. Organizing achieves coordination among different departments. Look at the hospital. We have the maintenance department, we have the radiological department, we have got various departments, but because of that organization that is at the hospital, it helps us to coordinate. That is the importance of organization. And then we have organizing creates scope for change. So when you have organized things, you are able to see where change is needed. Let us now move to another management function, which is directing. What is directing? Directing means giving instructions, guiding and counseling, motivating and leading the staff in an organization in DEC to achieve. That common phrase that we hear people calling themselves in the streets, Director General, hey Director. So that means that person gives instructions, guides, counsels, motivates, and leads the staff in an organization in doing work to achieve organizational goals. In simple ways, we can say directing engages 3 sub-functions: communication, leadership, and motivation. So that's just directing. Let's discuss more about the importance of directing, but what you just have to understand is when you are directing, you are just giving instructions. No, I'm asking for directions. From here to the market, how should I move? Then you give someone the directions, just like that. You are giving instructions. You are trying to guide and counsel as well as motivate and lead. That's what directing is. Shouldn't be something that should be complicated. What is the importance of directing? Number 1, directing initiates actions to get the desired results in an organization. You are guiding, giving instructions. By doing that, you are making sure that you are initiating actions to make sure that you get the results that you want. Number 2, directing attempts to get the maximum out of employees by identifying their capabilities. Remember, we said there is giving instructions, motivating and leading these people. So by doing that, you are attempting to get the maximum out of the employees by identifying their capabilities. Number 3, directing is essential to keep the elements like supervision, motivation, leadership, and communication effective. For you to have a good supervision, to keep the motivation going, as well as have some excellent leadership and communications at the facility where you are working from, there must be some good director, or you must be a good director who is able to give good directions. The last one, direction ensures that every employee works for organizational goals, because you are giving instructions, you are motivating and leading these people and guiding them where they shouldn't do things. By doing that, you are making sure that each employee is within the scope, or they are doing the things that they must do to achieve the organizational goals. What is coordination? Coordination is simply the process of trying to link up different departments and human resources so that you can achieve set goals. Now, if you remember in mathematics, there are those graphs that we used to plot. On the x or y, you plot 1, 2, 3, 2, then you link up those coordinates, right? So that's what we are discussing here. It is just a matter of you linking up different departments and human resources in order to achieve set objectives of an organization. At a health facility, it might be linking the geography department, the theater department, as well as the wards, so that we can work together in the provision of health care to the people out there. That is what coordination is. What's the importance of coordination? So coordination is important in a way that it creates a creative force. A group of efforts, when coordinated, creates a result greater than the sum total of the individual and isolated. When you come together as a team, you coordinate, you are able to do great things. Unity of direction. You remember the principles of management according to Henry Fayol. There was unity of direction, which is just moving direction as a health facility, because all the departments are well coordinated and all prioritize the patient. High employee morale. Coordination enhances the general level of employee morale and provides satisfaction. So that is the importance of coordination. So coordination is one of the things that is very important to a manager. Let us now discuss controlling. Controlling is determining what is being accomplished, that is evaluating performance, and if necessary, applying corrective measures so that the performance takes place according to the plans. As a manager, you must make certain that the whole thing occurs in compliance with the plans adopted, the directions issued. That way, you'll be able to control work and the people you are managing very well. What is the importance of controlling? Control system acts as an adjustment in organization operations. So in case someone goes too high, you are able to control them so that they can come back in a way they should be. Number 2, it mainly checks whether plans are being observed and suitable progress towards the objectives is being made or not, and if necessary, any action to control the deviation is taken. So when you are controlling, you are trying to see, is what we are doing in line with our objectives and what we want to achieve at the end. If it is at the health facility, is what we are doing helping the patient to recover on time? If not, for example, if nurses are not washing their hands after attending to a patient, you quickly move in and say, no, what you are doing is not helping the patient. By that, you are controlling, and it will help you to achieve your objectives, which is providing health care which is of high quality to your patients. Number 3, exercising some authority and forming superior subordinate relationship throughout the organization can be established through controlling. 4th, with the presence of authority or control, the individuals will work properly and exhibit better performance to reach the targets set for them. The last one is control system ensures the organization efficiency and effectiveness. When there is a proper system, the organization effectively achieves its objectives. Let's now discuss staffing. Staffing is simply putting people to jobs. You want a job. When they employ you at that facility, they have staffed you. You are a member of staff. So what is staffing? Staffing is the function by which managers build an organization through the recruitment, selection, and development of individuals as capable employees, as we said. Now, what are the functions, or what's the importance of staffing? So filling the organization positions. They need an RN, a PHN, they employ that, they bring in that nurse, at your facility, they have staffed, that is filling the organization positions, developing competence to challenges, retaining personnel such as professionalism, optimum utilization of the human resources. Those are some of the importance of staffing. Ladies and gentlemen, those were management functions that we have covered in this video. Next, when we meet, we'll be discussing Unit 3, which is about communication. Leave you with a quote: it's not what people see in you that matters, it's what you see in yourself. Thank you.